Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're going to put on our detective hats for a really fascinating medical mystery. We're going to follow a trail of some pretty subtle clues, all hidden inside the human body, to solve a perplexing case that involves one single crucial nerve. So, picture this. A patient walks in with these headaches that just won't quit. But at the same time, one side of their face has started to droop. Now, on the surface, those two things seem totally unrelated, right? But what if there's a single nerve connecting them both? Our job today is to figure out which one it is, and more importantly, what it's telling us.
Okay, so let's get right to the case. And this isn't just some hypothetical. This is based on the kind of real-world clinical puzzle that doctors have to solve all the time. Here's our case file. We've got a 54-year-old man. For the last 2 months, he's been dealing with a headache that's just been slowly getting worse. And along with it, he's noticed a growing weakness on one side of his face. The key thing here? No accident, no injury, nothing to explain it. These are the raw facts we have to work with. So, we have our initial facts. Now the real work begins. You know, in medicine, just like in a good detective story, every single symptom is a clue. You just have to know how to read them. Let's start breaking down this evidence.
First up, let's zoom in on that headache. See? It's not just some random pain. Its specific character is telling us a story. This is our first major piece of evidence.
Look at this pattern. The patient describes the headache as throbbing. It's at its absolute worst right when he wakes up. And it gets even worse with any kind of straining, like coughing. This is not your typical migraine or tension headache. No way. This specific trio of symptoms practically screams one thing to a neurologist. There is increased pressure inside the skull, almost certainly from some kind of growing mass.
Okay, so clue number 1 is pointing to pressure in the skull. Now let's turn our attention to our second big clue, that weakness in his face. And again, the specific details of how the face is weak are going to be absolutely crucial for locating the source of the problem.
So when you look at him, the line from his nose to his mouth on the left side is totally flat. His lower lip is drooping, and he can't quite close his left eye all the way. This tells us the entire left side of his face is affected. So here's the key takeaway. This isn't a problem high up in the brain's control center. Nope, this is a problem with the nerve itself after it's already left the brainstem. It's what doctors call a lower motor neuron lesion.
And then we get the smoking gun. The MRI scan comes back, and it's like the crime scene photo that confirms everything we've been piecing together. There it is. A mass right at the back of the brain in an area called the posterior fossa, and it is literally pressing on the root of the left facial nerve. Our two big clues, the pressure headache and the facial weakness, are officially undeniably connected. So, we know a mass is pressing on the facial nerve, which you might also know as cranial nerve 7. But to really crack this case, we need to trace this nerve's exact path. Think of it like looking at a map of the crime scene to understand exactly what's happening. Let's follow this nerve's journey together. It starts at the brainstem, travels through this narrow little canal in the skull right near the ear. And along the way, it gives off these really important early branches. One goes to a tiny muscle in the ear, another handles taste. And this is before it finally pops out of the skull to control all those muscles for smiling and closing your eye. And this is so important. If there's a problem early in the path, right near the brainstem, it's going to affect everything else downstream.
And now, for the real masterstroke of our deduction. There is one final, incredibly subtle symptom that this patient is almost certainly experiencing. And it's a clue so specific, it will pinpoint the exact location of the damage on that nerve with just breathtaking precision.
And that clue has a name, hyperacusis. It's a condition where everyday sounds, like dishes clattering or a phone ringing, suddenly seem painfully, abnormally loud. It sounds a little strange, I know, but trust me, it's directly connected to our mystery. So how on earth is this connected? Well, remember that first little branch the facial nerve gives off on its journey? That branch controls the tiny muscle deep in the middle ear called the stapedius, and its only job is to contract and dampen loud sounds to protect your inner ear. It's basically a tiny, built-in shock absorber for your hearing.
So here's the aha moment. If the facial nerve is damaged before that little branch splits off, that stapedius muscle is paralyzed. It just can't do its job anymore. And without that dampening effect, normal, everyday sounds suddenly become overwhelming and painfully loud.
So, the presence of hyperacusis is the final definitive clue. It tells us that the mass isn't just affecting the facial nerve somewhere randomly along its path. No, it's affecting it right at the very beginning of its journey, very close to the brainstem, before it gives off that branch to the stapedius muscle. We've pinpointed the exact location. Case closed.
And just to be thorough, let's look at the other suspects in our lineup. If the patient had lost sensation, like feeling, in their face, we'd be looking at the trigeminal nerve. A hoarse voice, that would point to the vagus nerve. Just hearing loss, vestibulocochlear nerve. None of these other cranial nerves fit the specific evidence of whole face motor weakness. Our case against the facial nerve is absolutely solid. So, after all that detective work, what's the one big lesson, the single thing you should take away from this whole investigation? It all boils down to this one incredibly powerful clinical rule. When you see facial paralysis combined with hyperacusis, that sensitivity to sound, you can be pretty darn confident you're dealing with a lesion on the facial nerve that is proximal, meaning very, very close to where it starts at the brainstem. It's just a beautiful piece of diagnostic logic. It really makes you think, doesn't it? A person's simple complaint about sounds being too loud can actually help a doctor locate a tumor inside their skull. The body is constantly sending out these detailed signals, these tiny little clues about what's really going on inside. And it makes you wonder, are we always paying close enough attention to hear what it's trying to tell us?